Hi, I'm Nurse Maria. I hope you had a wonderful experience with Dr. Guorgui and his surgical team. Now that you're home, we'd like to ensure that we give you the appropriate instructions. We'd like your recovery to be just as amazing. Let's talk about the remainder of today. For those who had sedation, we advise that you not drive or consume alcohol for 24 hours. Surgical extractions. We advise that you not spit, drink from a straw, or smoke for several days. All three of these things can dislodge the blood clot that's forming that can cause bleeding as well as delay healing. Let's talk about bleeding. It's expected you're going to see a little bit of bleeding following your procedure. Don't worry. What do? Well, we'll be providing you with what is called a 4x4 gauze that looks like a square. What you're going to do is fold that gauze 4 times. 1, 2, 3, and 4. So it looks like a little square. And what you do is you're going to take that piece and you're going to apply it directly on top of your surgical area. So whether it's your wisdom teeth or whether you had teeth removed at the front, make sure that that piece of gauze is sitting as far back into the corners of the mouth for wisdom teeth patients. It's not the soaking of the gauze that stops the bleeding, but rather the pressure on the area. So we ask that you make sure that the gauze is sitting directly on the surgical area and that you apply as much pressure as possible, and that blood clot will form. Keep changing the gauze every half an hour or until you see the bleeding has subsided fully. If you still have a little bit of bleeding at bedtime, we advise that you not sleep with the gauze in your mouth. Just remove the gauze, maybe put a towel over your pillow, and reassess in the morning if you still have a little bit of bleeding. Some people will experience a little bit of bleeding the following day, and do not be alarmed if you see that. Swelling. Some people swell and some people don't. If you start seeing swelling, typically you're going to start seeing swelling day 3, day 4, and day 5. So don't be alarmed if you wake up on day 3 and you're a bit swollen. But there are lots of things that we can do today to prevent swelling from occurring. What can you do? Number 1, ice your face right away. Grab an ice pack, take it, place it externally on the face, place it directly on the surgical area. And you're going to hold for 20 minutes, and you're going to take it off for 20 minutes. On for 20 and off for 20. If you've had extractions done on either side of the face, then you're going to alternate. 20 minutes, 20 minutes, 20 minutes, and keep doing that all day today. Number 2, elevate your head. So over the next 3 days, you want to take a couple of pillows, prop yourself up, and you want that head a little bit elevated. That elevation will help keep the swelling down. Number 3, if you were given an anti-inflammatory medication from Dr. Guorgui, we ask that you continue with that anti-inflammatory for at least day 3 to day 4. What can I eat? That's usually the first question most people ask. Now that you're home, go ahead, have something to eat. But know that there are a few restrictions. It's temporary. You're pretty frozen, aren't you? That freezing is going to wear off gradually over the course of today. But it can make things rather difficult in terms of your swallowing. It's temporary. That's why we ask that you start on a non-chew food item as soon as you get home, like a broth. Once that freezing wears off in a couple of hours, then you can go ahead and start having a soft food diet. Your soft food diet is going to be continued for at least 7 days following your extractions. A soft food diet is anywhere from pastas cooked really well, to yogurt, to ice creams, to fish, maybe a milkshake. Avoid that straw. Stay well nourished, well hydrated, and you'll heal faster. In terms of temperature, cold is perfect. Ice creams, milkshakes, it feels good, it'll help with the inflammation. Temperature hot, not so much. Hot will 1, promote bleeding, and 2, if you're really frozen, you can burn yourself and not even realize it, so be careful. Allow your foods and beverages to cool down to a room temperature. Brushing, let's talk about that a little bit. Dr. Guorgui placed some stitches in your surgical areas. Those stitches will fall out over the next few days on their own. Don't be alarmed if some can unravel the same night. It's okay. They tend to do its job within the first couple of hours anyways. So, no rinsing or brushing today. Why? Because we don't want to disturb the blood clots. So no brushing or rinsing. Starting tomorrow, you can go ahead and start rinsing your mouth. And you can go ahead and start brushing your teeth, avoiding the surgical areas. On day 7, 1 week following your procedure, you can go ahead and start brushing with a clean toothbrush and a little bit of warm water. You can start brushing directly on the surgical areas. All 4 if that's what we've done. Don't be afraid. The surgical areas cannot be injured if you're brushing them gently. This will help encourage it to keep the areas nice and clean, and we want to make sure that you do not develop any infections. Rinsing. I know how badly you probably want to rinse your mouth right now, but we ask that you not. And the reason for that is it'll disturb the blood clots. It'll just take forever to stop bleeding. So avoid doing that today. We're going to start rinsing tomorrow. A day following your procedure, you're going to start by either using the medicated mouth rinse that Dr. Guorgui prescribed. If you weren't prescribed a medicated mouth rinse, then you're going to use warm saltwater rinses. Both act as an antiseptic, which means that'll help kill the bacteria in your mouth, making sure that you don't develop any infections. So starting tomorrow, what you're going to do is you're going to take a cup of warm water, put half a teaspoon of salt in there, stir it up, swish gently for 30 seconds, don't spit, open, and just let the water drizzle out. So you want to do warm saltwater rinses 3 times a day. You want to continue with your rinsing for at least 7 days following your procedure. Let's talk about the Monoject syringe. If you check that little white bag of yours, we would have provided you with what we call a plastic Monoject syringe. This syringe is going to be started 1 week after your procedure. So when you're allowed to start brushing your gums back there in a week, that's when you're going to start using your syringe as well. What you're going to do is just draw up some warm water, and you're going to use the tip and place it directly inside the surgical areas. Don't hover over on top. That's a common mistake people make. They're a little scared. Don't worry. Get the tip, get it directly into your socket. Just the tip of the Monoject syringe. And what that will do will help dislodge any food that kind of gets caked into those areas. You want to use your Monoject syringe and you want to brush those surgical areas at least 2 to 3 times a day for at least a couple of weeks following your procedure or until the surgical areas have fully closed. If Dr. Guorgui prescribed you a prescription, we ask that you fill that out if you haven't already done so and to start it. Your antibiotic was prescribed to prevent infection. We ask that you fully complete it. Depending on your health history, you would have been either prescribed 1 to 2 pain medications. Please follow the instructions you were given. 3, mouth rinse. Again, the mouth rinse is to be started tomorrow, whether it be a medicated mouth rinse you were prescribed or the warm saltwater rinses. You're going to start this tomorrow, 3 times a day for at least 7 to 10 days. If you experience any severe nausea, diarrhea, or vomiting from these drugs, please do let us know. Please follow these instructions as closely as possible. They've been designed to help you heal quickly and comfortably. Bye for now.